Hello there, I'm Randy Rowett, and welcome to another edition of Randy's Wellness TV. We are here on location today at Truelife Chiropractic in Bronte, and we're joined by Dr. Jeff Beleutz. How are you today, Jeff?
Very good. Nice to meet you again.
Nice to talk to you, and it's a treat to be here today, especially on a nice day outside. It's sunny. Yes. And tell us, how long have you been a chiropractor for?
I've been a chiropractor almost 12 years now.
Okay, 12 years, a long time.
It's been, I know, it doesn't. It goes by very quickly.
Right, where did you study?
I studied at Palmer College of Chiropractic in Davenport, Iowa.
Mm-hmm.
It's the original college for chiropractic, founded over 100 years ago.
In Iowa?
Yeah.
That's interesting. And how long, and you've been practicing?
For 12 years.
12 years, you said. That's great. 12 years is a nice long time. And in this location all the time?
No, my original practice was in Sutton, and then I sold that practice and started this one here in Bronte just 5 years ago.
Okay. So what is your philosophy about the general premise of chiropractic?
Well, the basic premise behind chiropractic most people aren't that familiar with. They feel it's about the bone cracking or bone crushing kind of nickname or moniker we have. But chiropractic was always based on the premise of your nervous system, because your nervous system controls and coordinates every other system in your body. We were designed to be healthy and vibrant and full of energy. And when that energy system, which is housed within that nervous system, becomes a little faulty or overstressed, it starts to short circuit, so to speak, and then the body parts don't function at their optimal, and then you don't feel as optimal as you should. So chiropractic was always about influencing or improving the nervous system through the adjustment of the spine, because that's where the nervous system is housed, to improve your state of health and well-being.
Right. So you've got three different types of nervous system, really. You've got the autonomic nervous system, the central nervous system, and the peripheral nervous system. How does chiropractic benefit, or does it benefit all three of those?
It basically benefits all three of those. Its main purpose actually is in the central nervous system, and through changes that can be elicited in the central nervous system, we make changes in the peripheral nervous system. And you had mentioned the autonomic nervous system, which is the nervous system that again feeds your organs, tissues, glands. Your immune system controls your blood pressure, things of that nature. Chiropractic studies have shown a dramatic effect within that system, which most people don't realize, that chiropractic affects overall health, overall body function, not just ache and pain relief.
Right, overall body function, that homeostasis or balance, as they say. Yes. And what are some of the most common problems that somebody will visit you for?
That's very wide-ranging. They can bring children in for ear infections and colic, which most people are surprised by. But again, if you can influence the nervous system, make the overall state of well-being and health and the immune system function better, people recover from illness and injury much quicker. So we'll have children in here. We'll have people with gastrointestinal or stomach problems, digestive problems, fibromyalgia, obviously things like low back pain, sciatica, migraines, neck pain, radiating pain down the arms. Those are just some of the simple things that come in. My clinic here has started to evolve into more of lifestyle as well. So people come in with problems of anxiety, frustration, depression, and how they're relating to their world and how that's impacting their health and also how that impacts their lives. So we've moved into what I call life care, not just health care.
Life care, not just health care, and that's really a wellness concept.
Yes, absolutely.
It's not just a short-term treatment relating to a chiropractic procedure. It involves the total life balance and how people live every day. Is that right?
That's right.
Can you give me an example?
Well, people would come in, again, maybe suffering from an ache or pain, and it's usually related to how they've dealt with the life stresses of their daily life.
Which there are many.
And through my seminars that I give here, we go through an educational process with people to make them fully aware of that there are basically physical stresses, chemical stresses, and mental emotional stress that impact your nervous system, primarily your central nervous system, that radiates through all the other nerves to every cell of your body, and then that tension or stress starts to house within the muscles, the joints, your organs, or again, mentally, emotionally in your mind. When those systems get overwhelmed, they start to bring up some kind of symptom related to that tissue or organ or those specific areas.
Right.
So what I learned in my first practice is people would come in, I'd adjust them in a more traditional sense, relieve the tension, they'd feel better, they'd leave my office, and within a week they'd come back in, and the same pattern of stress was in their body.
So the idea was, you were treating some of the symptoms, but the cause of these people was not being in focus, so you decided to implement this true life concept and that actually affected them to work on that cause as opposed to just the symptoms.
Right. What I reasoned was, and it's just in learning with people as you practice with them, that their problem was what was going on outside in their world and not what was happening in here.
Wow.
So while, yes, if I adjusted them and made them feel well here, it's really their answers are outside. It's how they're dealing with their life. How are they dealing with their physical, chemical, and mental, emotional aspects of their lives? So we've developed a system in chiropractic. It's called network spinal analysis.
Network spinal analysis.
Yes.
Okay.
Which basically the tenet of that is to reprogram how you're dealing or looking at the stresses of life.
Wow.
By changing your nervous system, you change how you feel about any given event. It's your nervous system that dictates your reality, your perception and your reality.
Wow. And you see, here we are living in a society which is very hectic and fast-paced, and people are driving on the roads for hours every day, and they're sitting in front of those computer screens, probably not even ergonomically correct.
Correct.
And they're getting all these tensions and build-up. So really you have to deal with those and treat those causes, not just the symptoms.
Right, right. If you can get to the root cause of most people's problems, correct that, then the ache, pain, symptom, illness, digestive problem, immune system challenge, and or anxiety, frustration starts to diminish.
Right.
The basic premise, again, in chiropractic is that we were meant and born to be healthy and vibrant, and the only reason we're not is because there's something that's interfering with it. The body is a self-healing, organizing mechanism. It doesn't need any help, it just doesn't need any interference.
Nervous system interference.
That's right.
Yes. Very interesting. And what's the correlation? Maybe you could ask me, maybe you could advise me of this. What's the correlation? Is it a true complementary treatment to have chiropractic and massage for a person together?
Absolutely. I mean, particularly this form of chiropractic works well with any positive influencing thing that you're doing for your health, whether it's massage, whether it's Pilates, yoga, exercise, dietary changes.
Okay.
There's a study done with this type of work, and what we found was people who were doing other positive health and wellness enhancing programs got double to triple the effect of those things when we worked with their nervous system to clear it up, to free it up, so that it can take those beneficial things that you're doing in your life and actually solidify them in your life.
Okay.
A lot of times people will know what they need to do, but they can't seem to do it or it's not effective. Clear the nervous system and then those things become effective.
So unblock.
So unblock,
Right.
take the challenges away, and the person will start to thrive and make wondrous changes.
And that's an entirely holistic concept because psychologically it's an effective treatment also.
Oh, absolutely.
Yes. Can you explain to me why we're wearing the same shirt?
That's just kind of, yeah. I want we're almost dressed identical. That's pretty, I didn't call it that.
That's a coincidence, yes. But I guess that's holistic thinking. Great minds.
We're on the same wavelength.
That's right. So what we're going to do now is we're going to look at the scanning and the analysis portion of the program. We're in the office with Dr. Jeff Beleutz, and we're going to do something a little bit different here as far as chiropractic goes. We're going to do something called scanning. Can you just explain that, Jeff?
There are basically essentially three parts to your nerve system.
Right.
There's what we call the sensory nerve system. So someone will come in with an ache or pain.
Okay.
That's basically nerves coming from your body, traveling to the spinal cord, up to the brain, so that you can be aware of what's happening. Okay?
All right.
That's something that you can tell me about. You can say, oh, this hurts, this is bothering, whatever, and you can rate that.
I do have a little bit of lumbar pain,
A little discomfort in your low back.
Mhm.
So again, that's a sensory nerve. I rely on you for that information, okay?
Okay.
Because everybody has their own levels of ache and pain tolerance and things of that nature.
Right.
So you grade that. You give me that information.
Okay.
But what you cannot tell me about is when the brain is sending a message back down the spine and out the nerves. And there are two essential or basic areas of that. The brain sending a message out the nerves to the muscles to control and coordinate your muscle function, stability, and your posture, and also the nervous system where the brain is sending messages out into the internal organs. So that's what we use the computer for. It will scan those other parts of the nerve system that you can't tell me about. And thus we have a more complete picture of your nervous system stress patterns, because you've told me about one half,
Right.
the computer tells me about the other half, and then we can monitor your care to make sure that not only are you feeling better, but you actually are better. The human body's pretty funny in that if it functions around 60-70%, you may get some vague symptoms, but not a whole heck of a lot.
Right.
Once it hits about 49%, that's when everything breaks loose. All of a sudden, your symptoms really start to come up the surface. People will then do something. They'll either sometimes get a massage or have an adjustment, relax, go do whatever they need to do, and if your function starts back up to about 60%, your symptoms tend to diminish, but you're not really healthy. You're just on that cusp of being ache and pain back and forth, back and forth. Most people live their lives that way.
So they have to learn how to correct that.
They have to learn to correct that. And this allows me to monitor to make sure that we're getting 70, 80, even 90% nerve function.
Right.
Which is more health orientated as opposed to just symptom orientated, which is more what we have with disease care. Again, we're about health and well-being and life care. Okay?
So postural correction is a major part of this.
Absolutely.
Okay.
I've had clients that gain at least half an inch as we're doing our work.
Wow.
So right
It's
now,
a significant half an inch.
Yeah, it is significant. One of them was in their 70s, which is somewhat unheard of when you're that age.
Wow. Okay, so what are we doing now?
Right now, we're going to scan just the internal nerve system, which is feeding organs, tissues, glands, discs, things of that nature.
Right.
It's
You're
also
looking at a screen here.
Yes, I'm looking at a screen just so that I can see where there may be some areas of disturbance in your nerve system. Areas where we get some color are areas where are what we call hot spots. So this is taking a temperature reading, which is an indirect way to measure the nerve system that feeds your blood vessels, because it will either constrict or dilate your blood vessels, that nervous system, which will give off less or more heat. So based on that, we can infer some information about the nerve system that would not only feed the skin, but also internally to things like your liver, your heart, your kidneys, your bowels, things of that nature.
So how are hotspots shown on this graph here?
Basically with the colored bars here.
Okay.
Red being severe, which you have one, at
Yes.
L2.
I feel it.
Okay, L2 is in your lower spine here.
Right.
And that again could feed things like your large intestines or small intestine area.
And that could impact digestion, right?
Yes, that would impact your digestion.
Mm-hmm.
Let's move up, because we can't do a full scan with you here.
Okay.
But we will move up to the neck area. And if you just sit nice and relaxed, looking straight ahead, and we'll start here. And now we're checking for the nervous system that would feed the neck area and into the throat, sinuses, eyes, ears, nose, and upper chest.
So how long does it take this process to scan overall?
For maybe 5 to 10 minutes max, not even. And
this is different because this is a specialized assessment tool
Yes, it
that
is.
not a lot of chiropractors will use.
not most, but we're finding more and more chiropractors will use this because it's a wonderful window into your physiology. How is it functioning? Allows us to get a hard copy. It's very similar to you taking your blood pressure. Now we know what your readings are. Then we can compare them after we do care to make sure that you're getting better. Okay?
So
Beautiful.
if you don't know the overall physiology in terms of the person's individual characteristics, then you don't know how to correct it. So that's
right.
why the scanning is good.
That's right. Now, if you
Yes.
want to stand up here,
Okay.
and we're going to do another form of testing that I do.
All right.
It's quick and simple. One of the things that we always look for, obviously, are posture.
Right.
So one way that you can assess someone's posture is...
And here's where he's going to give me trouble because of my posture.
Yeah. There are
Okay.
several ways to do it, but a nice simple way is we simply put our fingers under the ears to look for a leveling of the ears to see if the head is level on top of the neck.
Okay.
And right away, Randy, we can see that your right ear is much higher than your left by about half an inch.
Okay.
So that tells me there's a displacement of the head in one direction, causing a tipping, which again can affect the muscles and also the nerves exiting.
So Jeff, if you have that, is it possible that it could lead to maybe a little bit of hearing trouble, interference?
It's possible. It depends on if you're really interfering with a lot of the nerves that come back and feed up into the head,
Okay.
particularly the circulation back into the ears.
All right.
Then we go down to the shoulders. And again, Randy, do you feel like you're standing in a normal position and comfortable? Whatever's natural for
Well,
you, please.
because I'm standing here and being assessed, it's not, I guess, natural, but I
But
feel
as best
comfortable.
you can. Okay.
Right, yeah.
Again, your right shoulder is dramatically higher than your left by about, at least, again, half an inch.
Okay.
Now, sometimes it might be hard to pick up on the camera, but
And
this
for
one
people,
here,
what would be that cause?
again, that could be physical trauma, an early whiplash, birth trauma, and that's again why we bring a lot of children in here, because we like to assess their nervous system and their body function at an early age, because it's much easier to correct.
Right.
But again, poor posture, work ergonomics, things of that nature. Now, when we move down to your pelvis, it's not as far out of line, surprisingly. You've got slight high left hip.
That's what I've been told.
Okay.
Yes,
So
yeah.
now I have an assessment of the posture, and we'll see if that starts to shift and change. Other ways to look at the posture is make sure you're looking
Because I'm
straight
standing
ahead.
here and being assessed, it's not, I guess, natural, but I
But
feel
as best you
comfortable.
can. Okay.
Right, yeah.
Again, your right shoulder is dramatically higher than your left by about, at least, again, half an inch.
Okay.
Now, sometimes it might be hard to pick up on the camera, but
And
this
for
one
people,
here,
what would be that cause?
again, that could be physical trauma, an early whiplash, birth trauma, and that's again why we bring a lot of children in here, because we like to assess their nervous system and their body function at an early age, because it's much easier to correct.
Right.
But again, poor posture, work ergonomics, things of that nature. Now, when we move down to your pelvis, it's not as far out of line, surprisingly. You've got slight high left hip.
That's what I've been told.
Okay.
Yes,
So
yeah.
now I have an assessment of the posture, and we'll see if that starts to shift and change. Other ways to look at the posture is make sure you're looking straight ahead. We look from the side view, and basically this point near the ear, this point in the shoulder, this point in the hip, and then down to the feet should all be in line, and right away we can tell that your shoulders tend to round forward and your head has translated forward.
So you have various reference points.
Right.
Okay.
And that lets us know that there are some deficiencies in your posture, which again will explain some mechanical muscle tension that people tend to suffer from.
Okay.
Now here's the most fun part. Close your eyes for me, Randy. And with your eyes closed, I want you to simply march up and down in place
Okay.
and do your best to stay in one spot.
That's not easy to do with your eyes closed.
Now,
Not easy to do.
what we're doing here, and keep the eyes closed and
Sure.
march as best as you can.
Keep marching. Okay.
All right. What we're doing here is we're assessing how well your body is sending messages to your brain to be processed on where you are, and then send a corrective message back down the body to control and coordinate your whole system.
So how do you do that? How do you assess
Just
this?
keep doing that,
Okay.
because with your eyes closed, the brain now has to rely only on the body information and not your vision. Okay, you
Okay.
better stop now, Randy. And
Okay.
if you open your eyes, you'll
Wow.
see how far you've
I've
transported.
actually
You went
moved.
forward and to your right.
Do you know that I didn't even feel like
And
I
you
was
didn't
moving?
feel that.
No. Is that common?
That's very common. About 70 to 80% of my clients will have that problem.
I did not feel
Have a
like I was
seat here.
moving forward.
No, have a seat.
Okay.
And what that means is there's a disturbance in
Yes.
how your brain is processing information
Wow.
and sending it back down. To have a healthy business, healthy relationship, everything's based on good communication.
Right. And that could be a serious thing if somebody does not
Right.
observe these things.
Right.
Yeah.
So if the brain cannot see what's happening to the body and then send corrective messages, how can you recover from an illness, a stress, or a strain? You can't as well as you should.
Okay.
My job as a chiropractor is just to clear that up.
Right.
As a byproduct of that being clear and the body functioning more effectively, it heals better, recovers better, deals with life stress better. Those are the byproducts.
Okay.
Aches and pains go away because of a byproduct of you becoming stronger and healthier.
And that cannot be possible without the assessment.
Or without the assessment, correct?
Okay. So now what we're going to do is we're going to observe a little treatment. I'm going to have the benefit of Dr. Beleutz working on my manipulation. Well, he's going to manipulate my posture and also my alignment.
Well, I'll show you what it is.
Okay.
Okay, we're going to do an assessment and an
Okay.
actual treatment of the style of chiropractic that I do here.
Okay.
Now, you had mentioned, Randy, something about manipulation.
Right.
That's one of the kind of the pet peeves we have in chiropractic. We don't really manipulate the spine.
Okay.
We adjust your nervous system. Okay?
Right.
So what we're going to do is a form of an adjustment through what's called network spinal analysis. Now, again, how this system is different than most traditional styles is I don't have to do a more forceful pushing on the spine to make changes in that nerve system.
Yeah, that's something that I've never really liked, was the really aggressive form of forceful alignment.
Adjustments,
Yes,
yeah.
adjustment, yes.
Okay. Some people enjoy it, some people don't. What we found with this system, it's just a very light touch, either in the neck or in the tailbone, to influence tension in your spinal cord,
Yes.
which changes tension in the nerves that feed every muscle, joint, organ system, and or how it reverberates back up into the mind to create tension there. So think of it like tuning a guitar or piano.
Okay.
If it's out of tune when you play it, it plays different music, correct? Well, when your nervous system becomes overwhelmed through physical, chemical, or mental emotional stress, you get your backup, so to speak. You physically tighten your spinal cord and it starts to vibrate at a very high pitch, which sends that stress message to all the tissues of your body.
You know, I'm very aware now of proper positioning, and sometimes I'm sitting somewhere and I think, oh, my back's starting to ache, so I better readjust my posture.
Right.
And that's part of it. You have to learn
You
how
have to learn and be aware, and your awareness with this system will become so great that you'll be very conscious of what's detrimental to your health and what's beneficial, and
Right.
then you'll start making proper choices.
And what's important too, before you do the treatment here,
Yep.
is a lot of people think that you're actually cracking bones when you're doing,
Yeah.
the treatment, but you're not.
There, especially with this system, because it's just a light little flick. It's almost like acupuncture without needles.
Right.
Okay? But even a traditional chiropractic, that adjustment is not cracking of the bones. It's simply the tension that's locked in the joint
Right.
being released temporarily.
Mhm.
All right? Then the body functions a little better.
Yes.
Right? But as stress starts to build up, it tends to go back to those same patterns. What I'm attempting to do is reprogram your computer or tune your nervous system so it doesn't always go back into those faulty programs or patterns of strain and stress. So it doesn't keep loading it up in the hip or the low back or
Right.
in the brain or in the nervous system or in the immune system.
And this
Okay?
is kind of, this treatment is kind of like you were saying it was kind of like an acupuncture.
It's like acupuncture without needles.
Okay.
All right? It's somewhat similar in that it's so gentle and light. Okay?
Okay,
So-
so am I in the right position with
Yeah,
my hands?
you're
and
right.
everything?
You just lie
Okay.
there and relax. Try not
Okay.
to do too much. Most treatments take about 10-15 minutes. We'll just do a very brief one here.
Okay.
Now, as I have you lie here, do you feel like you're lying fairly straight?
You know, to me, it feels like one of my legs feels a bit like it's off, or a little bit longer or something.
Okay. Well, if you can come around here, you'll see that your right leg is a good half-inch shorter than
Wow.
the other. So that's an imbalance. Now, most people will have a short leg, and it's not that it grew shorter, it's that there's an imbalance in the musculature of the spine and the posturing. Usually raises the hip up, causes this leg to get shorter.
Oh, boy.
Okay?
So that's why some people walk.
A little bit off,
Right.
yes.
Yeah, okay.
So
Okay.
one of the things that we'll be looking at is whether or not this changes.
Okay.
Now my goal isn't to balance the legs, my goal is to reduce the nerve stress, and as the nerve stress reduces, your body becomes into more balance and this shifts all automatically.
Okay.
Now there are various tests that we're going to be doing. I won't go through all of them because it's a little too complicated, but it's just a way of assessing nerve system tension.
All right.
Turn your head to your right, please.
Okay.
Turn your head to your left, please. And now back to the middle. So your right leg stays short. Through all those tests, you have a problem with your pelvis and your tailbone on one side.
Okay. I agree. It's probably the left side. Yeah.
Well,
that's right.
surprisingly, it's your right.
Oh, okay. It feels like it's on the left. I guess that's maybe because of the nerves.
Well, what will happen is, and here's what an adjustment actually feels and looks like. It's just a light little flick at a key
Little
spot in the tailbone area to influence the nerve tensions.
So someone getting these little flicks may not think it's doing anything,
Exactly.
but it's actually the
You'll
nervous
see.
system.
And that's why we have our ways of testing and evaluation so that we can do post-test to make sure that there has been a change.
Okay.
So you just lie there and relax. Try not to disturb too much.
This is a good opportunity. I very rarely get a chance to lie down and relax.
That's true. One of the things that we'll start to notice is somebody's breathing will start to get better and much deeper, which is a sign that stress is being reduced. Most people are very shallow breathers because it's a sign that the body is in what we call stress physiology. It's all locked up with tension.
Right. Shallow breathing is not good. You're not
No.
getting air quality.
You're not getting air quality, you're not getting oxygen to the brain, to the lymphatic system. Your breathing helps pump your cardiovascular system. So everything works a lot harder and more ineffectively and inefficiently when you're not breathing properly.
I do feel my breathing's being slowed down a bit. I feel like a little more relaxed. Okay.
So, and then with that, and then we'll come down. Still a little bit short, so we'll come back and do another adjustment. Just a flick here, and a little pressure here. And just relax. My clients enjoy this technique because, again, it's very non-invasive, it's very gentle,
Yes.
and they find that not only do they physically start to relax, but they get a sense of, one of the most common things they say is they get a sense of peacefulness. They come up off the table and they're like, wow, I'm just feeling really calm and really good. And if they would spend more of their lives in that state of mind, guess how much different this world would be.
State of mind is really the key concept.
Yes, it is.
I noticed something different when we first arrived here. The other room, where we had our first interview. There's several beds in there,
Yes.
as opposed to just one.
Yeah.
Why is that?
A couple of reasons. One for practicality, because each adjustment takes 10 to 15 minutes. I will be adjusting maybe 3-4 people at one point. simply because as I'm doing some work, I'll do an adjustment like I did there. Then I'll move to the next client or patient, do an adjustment, then to the next one, do an adjustment, and then to the next one and do an adjustment. Then come back to the original first patient, which allows some time to have occurred for the body to make a change. That allows me to know if I've done an effective job with that adjustment, because everything takes a bit of time for it to change. So this way it allows me to reassess, readjust, and I usually go through that circuit 3, 4, maybe 5 times with anyone, so that we can make sure that there have been significant changes in their tension patterns. So that's one reason. The other reason, which sounds maybe a little more philosophical, but healing is contagious, just like laughter. And so many times we are taught in this culture that our problems are our own, we're the only ones with it, and we start to feel very isolated. All right, and as we become isolated, we start to become isolated from ourselves and our fellow man, and that's not about a healthy community.
Right. So you've got all these people out there, and how do you find it works between all the interaction between all
Well,
of
it's
them?
wonderful, because what will happen is one person will be starting to let go of their strain and stress, and you can hear the breathing enhance. You'll hear a sigh, and it seems like it gives permission for other people to let themselves go as well. Now, your legs are already balanced. Now, normally in a traditional chiropractic adjustment, I'd have you lie on your side, I'd put you into a pretzel kind of position, and I would do a light thrust to release your hip area, and I would have made the change for you. With this system, it was just through your breath and your body doing slight shifts that it performed the adjustment. So now you learned how to reduce that tension pattern basically on your own. I'm just here to help show the body how to do it, and it has performed it, because now you have a greater ability for self-recovery.
And remember when I said that I felt like one of my legs was longer?
Yep.
I don't feel that right now.
Well, it's not, because it's balanced out.
That's great.
So now I'll just do one more light adjustment here for the tension pattern that we see in this area through here.
So that
Little flick. And people are like, well, how can that do anything? Well, because we're influencing the nerve system.
It's a key point.
We're not trying to move bones around for you. Okay? Influence the nerve influences the muscle tension moves the bone. So now your body self-corrects.
Right.
Okay, and let's have you sit on up for me.
Okay.
And then we'll do a quick little recheck once you stand up now.
I feel that. Okay.
And standing nice and relaxed again. So we can quickly again assess the posture. Now the ears are still a little bit off center, but not near as much.
Because it may take more than one treatment. Right?
Oh yeah, definitely. I mean, it takes a series of sessions to influence. Shoulder, you still have a major issue there.
Okay.
Pelvis is a little more aligned. Now close your eyes, keeping your eyes closed.
Right.
Let's have you march up and down and try to stay in one spot again. Just keep marching up and down. And again, we're assessing how well your brain is receiving a message from the body and then sending it back down.
It is hard
If
to...
that circuit works well,
Yes.
you tend to work well.
Okay. I like to raise my feet high and march properly.
And stop.
Okay.
Okay. So again, you can open eyes. Now you're still drifting a little forward and a little to your right.
Not quite as far.
But not quite as far.
Yes.
So we do know that you still have some tension patterns that need to be resolved. But this was a good start. Now let's come on over here again.
Okay. So Dr. Beleutz, we just had the assessment, we had the treatment, and now we're in the post phase here. You're doing an assessment based on what already happened.
Correct. And
Okay.
we're seeing if that nervous system has shifted or changed the pattern of stress within it and how it's expressing that, again, through our computer scan. And what's nice about this is it's independent of the practitioner.
Right.
All right, so it's reproducible and it's very valid and very reliable. So I can see if after an adjustment there has been a significant change.
So wow, this is a fantastic scientific tool to be able to visualize and look at every disc, every area.
We're looking at every level of the spine, and again, look straight ahead. And we're seeing if the nerve system in that area has a disturbance pattern, and then it can relate to other tissues of the body. And what we like to see, and in most cases what we find, is a reduction of the overall stress patterns. Oops.
That's okay. And it will take a few times to have total benefit, is that right?
Generally speaking, yes. I usually put people on a program, a wellness program of care.
Okay.
We see people for approximately 2 months, and then we reassess them top to bottom and see where they're standing in that. But even after one adjustment, people have noticed significant changes.
Mm-hmm.
Okay, so there we are, and that's the end of the scan there.
Okay, what do you see?
So, if you want to kind of spin and turn.
So what do we see in terms of my improvement now?
Okay. Well, this was the original scan before the adjustment.
Okay.
The colored bars are where there's excessive tension or stress. Red being severe, blue being moderate, and green being mild.
Right.
Okay? So when I've looked at your scan, that's a significant amount of stress. You've got some at C1, which feeds back up into the head and controls overall posture. A lot of issues with the eyes, ears, nose, skull. Think of it like your main fuse box. So you've got a lot of tension there in the upper neck.
Right.
In your mid-low neck at around C6 and C7, that would be this area. That would feed into the throat, the thyroid, the shoulders, arms, hands.
So there could be a direct effect on the thyroid.
Yeah, there
if
could
it's not
be.
treated.
Right.
Yes.
Now, I won't diagnose any disease from this, but I know that if this stress and the nerve feeding that or coming from that area is consistently stressed out, then the tissue as it feeds will tend to be stressed, and eventually they may develop some kind of pathology. So
Okay.
we do not want to see that stress stay there consistently.
Prevention is the concept
Absolutely.
here. Now, what about my neck? Is there anything I can do to improve that? I mean, at home?
At
Something I
home,
can-
well, obviously exercise. There are some postural exercises that you can do. Massage will help out with some tension in the muscles, but we need to make sure that the nerve system is reset. And lots of times that won't happen unless you see a chiropractor or someone who does work that will work specifically for your nerve system. Okay? We move down to L2 again. That's going to feed your bowel area and or stomach.
Right.
That's got a lot of tension there for your digestion, and again a little bit at L5.
Okay.
So right away you can see 1, 2, 3, 4, 5, 6 areas with 1, 2, 3 being fairly high. This is before the adjustment, and I'll bring the next one up, which is doing the same areas post-adjustment. Oops, wrong one.
It's okay. So for the people at home who are viewing this, they can see that there will be changes.
Or did I not save it?
What's the age groups you treat?
Babies to 90 years old.
Really, babies?
Yeah.
You wouldn't think that a baby would need adjustment.
Oh,
Yeah?
Yeah, oh yeah.
That's amazing.
There we go. Here we'll bring
Well,
it
I
up.
guess to learn, learn type of body positions and
The
for
nervous
baby
system,
be-
yeah, see, it's not about the bones, it's
Right.
about the nervous system, and they have a nervous system that can get very stressed out.
Good.
Now here is the post-adjustment
Okay.
scan. So right away, what can you tell me about how many colors there are?
We have 3 green bars.
3, which are mild.
Right, that's
Okay.
mild. So
All the reds are gone, the blues are gone.
Mhm.
You have one of the similar area at the upper neck area, but again, that's mild
and the
now,
numbers seem lower.
and they're much lower.
Right.
A little bit at T10, a little bit at T12. So that's a very good response. You responded very well. And I could tell through the adjustment when your half-inch short leg balanced out fairly quickly that you were going to have that type of response. So that's a very good change in your nerve system. So I like to do that with everyone so that we can say, look, we can make a change. You are able to heal and recover because this can change.
Okay.
There you go.
And a final question here. Are you involved with many occupational health type of recovery programs for
As
treatment?
far as treatment of injuries?
Injuries, office problems, that type
Yes,
of
a lot of times people come with problems related to how they're managing their office work. Again, a lot of carpal tunnel, shoulder
Right.
headache, all that kind of stuff. And again, that tends to be posture and stress-related. Work stress environment plus the posture as they're doing their work overwhelms the nerve system, and then they usually have some problems that need to be rectified.
Okay, well, I feel a bit better.
Right.
And that assessment really helped me today. So we're back in the office where we started from here at Truelife Chiropractic. So Dr. Beleutz, do you do any public education forums for people?
Absolutely. Again, with the concept of changing people's lives, people need education. So every month we have free seminars here. Once a month I go through my type of work and I explain how it affects their health. We educate people again on the various stress factors that they have in their lives.
Right.
We go through a little educational factor of the difference between disease care, health care, life care. And then we actually have guest speakers. So recently we had a personal trainer come in to go through exercise programs to make them more effective.
That's very important.
We've had Pilates and yoga, we've had meditation, we've had people who, naturopaths who do detox programs and educate people on that. We've had programs on female menopause and various programs. Again, with the idea that if you give the person information, then they have a chance to make a change, and the change is what creates a better life for them.
Right. So you've got all these beds here. Do you ever
Yes.
have the people after the treatment turn and start talking to each other and saying, wow, you really helped me as a group?
A lot of times they'll just do a line face down.
Really?
Next thing you know, yeah, they'll just start chit-chatting a little bit,
Very
and they'll one person will again be relating to another how they've been helped and what they've noticed, and another person will be saying, oh yeah, I noticed a similar thing.
That's great. Well, I thank you very much for having us here today. That's terrific.
Absolutely.
Thank you so much.
My pleasure.
And I got a nice treatment out of it too, and hey, I'm feeling a
Bonus.
little bit better, not so much pain. So that's another great edition of Randy's Wellness TV. I thank Dr. Beleutz of Truelife Chiropractic, and of course, as always, our cinematographer, producer, Joseph Lau. We'll see you next time. Stay well and take care.